In this tutorial, we will demonstrate two things: the Perio chart creation and the Perio reports. In the creation of Perio charts, we will see how we can enter values for probe, furcation, adhesion, mobility, and diagnosis. And we will view the reports that relate to mobility, probe, and adhesion. To enter a new Perio chart, click on the button New Periodontal Chart on the top right. As you can see, a new entry has been placed with today's date. We can add a description for the Perio chart. Let's enter initial exam. On the left, we have the functionality buttons. We can enter values for probe, furcation, adhesion loss, mobility, and diagnosis. Double-click on the tooth. If, for example, you want to remove tooth 15, double-click on tooth 15. To reinstate tooth 15, double-click on the empty space that used to be occupied by tooth 15. To enter probe values for the top jaw, click on button Probe. The cursor is positioned automatically in the first probe box. We start entering values. Once we enter a value in a box, the cursor is moved automatically to the next probe box. With each value entered, there appears a graphical representation of the probe value. Probe values 0 to 4 appear in blue, and values 5 and over appear in red. The maximum probe value you can enter is 15. The question is, how do you enter a 2-digit probe number? For example, let's say that we want to enter probe value 12. In the specific probe, we press the control button, release it, press 1 and then 2. If you want to enter 13, control 1, 3. To delete the probe values, click on the delete button. As an example, we will enter the probe values for the upper jaw. To enter furcation values, click on button Furcation or click in any furcation box. We enter a value, and to move to the next furcation value, we press Enter. To enter adhesion loss values, follow the same steps as in the case of probe values. Click on adhesion loss and start entering the values. For mobility and diagnosis, we enter one value for each tooth. The valid numbers for mobility are 0 up to 3, including the halves in between. To see the valid values, enter an invalid value in a mobility text box. Let's say 33. Press enter, and the user is informed of the valid values. In diagnosis, the user can enter characters to record the dentist's diagnosis. For example, the dentist may enter the letter G to indicate a good diagnosis. In practice, there are dentists who use this field for other reasons. Visual Dentist provides 3 specialized reports for periodontology. According to future needs, Visual Dentist will add reports as necessary. For the reports to make sense, we have added 2 Perio charts. The first one, as indicated here, has a description of initial exam, and the second one, second exam. We can select each Perio chart by clicking here. We now view the values of the second exam. To view the values of the first exam, click here. Let's go to the Reports button. To the reports. As we mentioned before, we have 3 reports. Report 1 deals with mobility, Report 2 with probes, and Report 3 with adhesion loss. Let's go to the mobility. This is an analysis of the 2 Perio charts, of the mobility in the 2 Perio charts. For example, for tooth 18, the mobility was 3 and then it became 1. That means that there was a 2-unit improvement. And as you can see up here, green means decrease, which is good. Red means increase, which is not good. And cyan means the same. So, as you can see here, green is good, red is bad. To go to Report 2, the probe analysis, we don't need to select 2 Perio charts because we only have 2. And in less than a second, we got this amazing statistics that basically compares. If we view the buccal view in the upper jaw, for every tooth we have 6 measurements, 3 for buccal and 3 for palatal. And again, green is good, red is bad, and cyan is the same. Up here we have the results in a collective manner. We have 24 cases or 24 measurements where the measurements became worse, 17 better, and 7 remained the same. Down here we have the total for the upper and lower jaw. 87 measurements became worse, 92 measurements became better, and 13 measurements remained the same. The 0 indicates that no teeth were lost during the treatment.